Now, this kind of stuff right here makes me crazy. So she's 37 weeks and her doctor does an internal exam, and it's very, very painful. Well, this means that the doctor did a cervical sweep. She talks about how there was blood and that now it's burning every time she goes to the restroom, and that the doctor has informed her that they're going to be doing this every week. What this says to me is that this provider did not discuss the risks and benefits of a sweep, or even give the patient the option to say yes or no. They just did it. This is absolutely unacceptable, and it happens all the time. The fact that they would be doing a sweep at 37 weeks, if over 70% of women who are left to natural childbirth would go into labor at 40 weeks, 6 days, or go into labor between 40 weeks, 6 days, and 41 weeks, 2 days, that means that this is an entire month ahead of when most people would be delivering. The risk of a sweep is premature rupture of membranes, which now also increases the risk of infection. And premature rupture of membranes means that the water breaks before it's ready to break, or before the body is ready for labor. And if this happens and labor doesn't start on its own, which frequently it doesn't, that means now the snowball of interventions is happening. If your provider is doing anything without talking to you about the risks and benefits, please go find another provider. And if you are a provider who thinks that this is okay, find another profession. And it's never too late to change providers, just so you know. A lot of people think it is like, oh, well, because they're insurance or whatever. It is not. It takes effort and time, but you can absolutely change provider. You have the right to informed consent on every single thing. You also have the right of refusal, which means you can refuse anything that they're suggesting. If you don't want to do it, if you don't want to do it again, if they do a sweep and you're like, that was really uncomfortable, I don't want to do it again, you just say no. The people that now walk into birth with this doctor knows best mentality of just like, whatever you say, doc, is making me crazy, because you don't understand the financial pressures, the scheduling pressures, like all of the things that determine the doctor's decision making. And it's not always what's best for you and your baby, just so you know. There are far too many people that come out of birth saying, if I would have known this, I would have never done that. I'm all fired up. Please do what you can to get educated. Childbirth education classes, sign up for our services at Birthify, something. You'll be better for it.